most famous physical therapist on the internet.
Hi there, folks. I'm Bob Schultz, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
If you stumbled along on this video, this is an introduction video to a video series. It's everything you need to know to treat shoulder pain successfully. So this is a whole series of videos on shoulder pain. Go to bobandbrad.com, go to the program section, and look for the shoulder series.
So it's kind of like a playlist, but it's
Right.
a program list. All these videos have different titles for different aspects of shoulder rehab and correcting your problem.
Right. You don't need to watch each one.
Nope.
Just pick out the ones that you think work for you. And with each video, we also include a PDF that you can print out so that if you don't want to watch the video again, you can just look at the printout and follow it.
It's just a review of all the highlights, particular exercises and things that you should or should not do that are emphasized on the video.
So some of the problems that we may be able to help you with are shoulder arthritis, tendonitis, impingement, rotator cuff tears or strains,
Right.
bursitis, and frozen shoulder. We did a couple of
Right.
videos on frozen shoulder.
What else is there?
Well, I don't know if there's anything else, but I hope we have covered it all. Our basic approach is that we believe overall, quite often, the reason you're having pain is something in your shoulders kind of in a wrong position. Therefore, it's not working right. There's like a dysfunction. And that dysfunction often leads to impingement. Now, the exception, of course, would be falls or if you're in a motor vehicle accident.
Right, or after a surgery.
Trauma. Yeah, right. So our first goal is to get the shoulder and shoulder blade back into correct position, and we're going to strengthen and stretch it and allow it to move normally and pain-free.
Right. We need to get the foundation of the shoulder where it needs to be so that the rest of the arm is going to work properly and get that shoulder joint, the mechanics sound.
Yeah, we're trying to have it so that your pain is going to go away and stay away.
Mm-hmm.
We're not, trying to calm things down and then you go back to doing things wrong and the pain comes right back again.
Right.
The second goal is to, especially in the beginning, we're trying to decrease the shoulder pain makers in your life. So a pain maker is an action or a position or a thing that causes pain.
Right.
So as simple as we're going to have you do videos on stuff you should avoid right now if you're having pain to let it calm down.
Right. Right.
The third goal is we want to strengthen the shoulder and the posture again so that we can maintain the correct position long term. So
again, all these videos are about plus or minus a few minutes, 10 minutes.
Right.
So they're short. The titles are more specific, and you're only going to pick out the ones that fit your needs.
yeah, you don't need to watch each one.
No.
We do, recommend you see a doctor because shoulder pain, it can be funny. It could be coming from your neck and upper back.
Sure.
It's hard to tell sometimes. Even when you feel it right in the shoulder, it could be coming from your neck. Definitely, if you've had trauma, you definitely need to have a doctor see it.
Sometimes it could be a combination shoulder and neck, and you need to address both of them.
Yes, and in less common situations, sometimes it could be a medical problem.
Sure.
Cardiac problem. I've seen that where people had shoulder pain and it was actually a heart issue.
Yeah.
Unfortunately, sometimes it can be cancer.
Right.
We heard about
20 years, I had one person where I was treating her for shoulder pain, and it was cancer, but it's rare.
Well,
usually a therapist can screen that out.
My
pretty quick,
sister
or a
just
doctor.
called me, and she was actually having a friend of hers watch our videos, and they took him in. His shoulder ended up breaking, and he had some cancer in the bone already.
Sure.
And that's how he discovered it. He was, at 50 years old. So our philosophy is that it's up to you to get better. There's no magic pill, surgery, or shot. I want you to get that in your head because Brad, I've had some medical issues, and I remember one time thinking, I'll just go in and have surgery, and the doctor kind of said, no, you got to handle this.
Sure.
And that just changed my whole way of thinking.
Right.
No, I'm not going to have surgery. It's up to me to get it better.
Right.
You're going to have better possibility of getting better if you think that way.
And if you do go to a doctor, particularly an orthopedic doctor, and the knee-jerk reaction is, we can fix this with surgery, and you're thinking, oh, I'd like to not have surgery. Maybe I could do some therapy first. You can either get a second opinion or just directly ask the doctor, can I try some therapy before I do the surgery? And
They may say no, but you can always ask.
we've treated a number of people
Yeah.
who were scheduled for surgery on their shoulder. We worked with them, and it was avoided without a big deal of therapy either.
Right, right. Sometimes it doesn't take much. The
Exactly.
body, that's the second point. The body wants to heal.
Exactly.
It's amazing. We got interesting stories of how the body healed sometimes when you didn't think it would, if you allow it.
Right,
So
exactly.
you got to put the right setting for it. You must believe and follow directions. It's interesting, Brad. But after treating thousands of patients, when they come in, I can almost tell you right away whether or not this person has a chance of getting better. Because some of them, especially if they come back the second time, and I go, "Did you do the exercises?" "No, I didn't have time." Or it's like, well, I go, if you have time, if you don't have time for that, you're gonna have to have time for the pain, because the pain's not gonna go away.
Right.
So if they don't take personal responsibility, and on vice versa, if the person comes back in and says, "Yeah, I did it every time. I did it every hour," or whatever, that person's gonna get better more often than not.
Very, very true.
So
Yep. I always ask them, can you show me the exercises that I asked you to do?
sure.
And it's a test,
Yeah.
because oftentimes, some people say, I didn't even do them. They're right out front, and the other ones will try to get through them. It's like,
Right.
well, you really didn't do them, did
Yeah,
you?
that's exactly
But
right.
that's all right. That's all part of.
I often say, I joke around with them. I say, I can tell when you did them or not. So.
Yeah.
And we're not a big believer in having someone do something to you. There's times where a therapist needs to do some manual stuff with you.
Right.
But I prefer that you learn to heal it yourself.
Right.
That's why we're big on the McKenzie method, because the McKenzie method is teaching you exercises to get yourself better.
Right.
So.
Yep. We'll always talk about posture first, working these muscles, change your activity as needed to improve versus doing ultrasound and massage.
Right.
The way therapists kind of were used to do it
Right.
30 years ago, maybe a little more than
Exactly. It was all hands-on, like we did everything.
now. Yeah.
So,
yeah.
all right. Well,
Cool.
check out the rest of the series, and we hope you enjoyed it. And make sure we, put your comments below so we can see what you think of it.
Absolutely.
So.
Good luck with those shoulders.
Thanks.